Hello, welcome to today's webinar on the topic of Outreach and Education, National Indian Health Board, a Centers for Medicare and Medicaid Services IT training webinar. My name is Amanda E. Fox, and I am from Kaufman & Associates, and I will be your moderator today. As a reminder, there is one upcoming webinar under the IT webinar series. Please join us for this webinar on the Office of the Inspector General, Preventing Fraud, Waste, and Abuse on June 25th at 2 p.m. Eastern. With those announcements made, I will now turn it over to Rachel Ryan Peterson to introduce today's topic.
Thank you, Amanda. Good afternoon and welcome to our webinar on outreach and education in partnership with the National Indian Health Board. I'm Rachel Ryan Peterson and I work for the Tribal Affairs Office at CMS. Just one quick housekeeping item before we get started. Throughout this presentation, I'll refer to several links with valuable information. You'll see in the upper right-hand corner of your screen that there's a pod that says reference links. We will include links in that PDF document that you can download, and those links are also listed in the slides at the end of this presentation. Our office, the Division of Tribal Affairs, or DTA, is part of CMS. Specifically, we're part of the Children and Adult Health Programs Group, abbreviated as CAP, within the Center for Medicaid and CHIP Services, abbreviated as CMCS. A list of DTA staff and Native American contacts, or NACs, are posted on our website. The link is in the downloadable PDF document and on our link slide at the end of this presentation. It's important to remember that even though we're located within Medicaid, we still work on all tribal issues that come up at CMS. We work closely with our partners in Medicare, Survey and Certification, the Marketplace, Data and Information Technology Offices, and the Office of Minority Health, among others. CMS has recently gone through a reorganization that gave us the opportunity to build up expertise on Indian health issues within the agency and better serve all tribal communities. Prior to the reorganization, we had 13 NACs assigned to each of the HHS regional offices. Many of the NACs had to balance their tribal work with other agency priorities and assignments. As a result of this reorganization, we took 10 of the 13 NACs who worked on Medicaid tribal issues about 20% of the time and condensed them to 4 NACs who work on Medicaid tribal issues full-time and 1 NAC who works on tribal issues half-time. By doing this, we're maintaining the same level of workload, but by consolidating the work, the NACs can dedicate and focus their work on Medicaid tribal issues and provide the technical assistance needed. We have also organized the assignments of the Medicaid NACs by the IHS area office designations instead of by HHS regional offices. Our NACs are Nancy Grano in the Nashville and Bemidji areas, and you can see these highlighted in pink on our map. Stacy Schumann in Albuquerque, Oklahoma, and Great Plains areas. Cindy Lamesh for California, Navajo, Phoenix, and Tucson. Rhonda Martinez McFarland for the Alaska, Portland, and Billings areas, and Vanetta Harrison, who is a part-time NAC, will focus on tribal work in those states that do not have tribal health programs or federally recognized tribes. You can see these in the gray shaded states on the map. Cindy Gillespie will continue as the Technical Director for American Indian and Alaska Native Issues, and we're also keeping Mary Munoz and Dorsey Sidange, who will continue to serve as NACs for CMS on Medicare and Survey and Certification tribal issues. This slide shows some of the history of Indian health and CMS programs. We want to highlight that the ability for ITUs to bill CMS is unique. This was intended to increase funding streams for Medicare and Medicaid for Indian healthcare programs and not to offset IHS funding. The ability to bill CMS has increased reimbursements to the Indian health system to over $1 billion a year. Reimbursements increase as more people enroll in Medicaid and Medicare, bringing more funding into the Indian health system to meet accreditation standards, buy necessary equipment like MRI machines, and recruit additional staff. Did you know that Medicaid, the Children's Health Insurance Program, Medicare, and the Marketplace are all part of CMS? IHS tribes and urban Indian organizations all have the ability to build these programs and increase their revenues. Medicaid is a joint federal-state program. For services provided to American Indians and Alaska Natives, the federal government provides 100% full funding to states, which we call the Federal Medical Assistance Percentage, or FMAP. But remember, this funding goes directly to the states, not IHS and tribes. By Congress allowing the federal government to provide 100% FMAP and fully fund care provided to American Indians and Alaska Natives, it helps fulfill the federal government responsibility to provide health care to tribes. Consultation is a critical part of addressing the unique needs of American Indians and Alaska Natives in our Indian healthcare delivery system, and CMS is committed to tribal consultation and working on policy issues impacting tribal communities and Indian healthcare providers. We consult through formal face-to-face meetings, all tribes calls, their tribal leader letters, and comments we receive through part of the rulemaking process. CMS is the only federal agency with tribal consultation at the state level. States with Indian healthcare providers are required to have tribal consultation plans in their Medicaid state plans. For more information, visit our state tribal relations page. This link is in the downloadable PDF document and on our link slide at the end of this presentation. The CMS Tribal Technical Advisory Group, or TTAG, provides advice and expertise on tribal issues facing CMS. We do a lot of our TTAG work through subcommittees such as ACA policy, outreach and education, data, long-term care, behavioral health, or strategic planning. TTAG consists of 12 representatives from each of the 12 IHS areas and a representative from each of the following tribal organizations: the National Indian Health Board, National Congress of American Indians, National Council on Urban Indian Health, Tribal Self-Governance Advisory Committee, and IHS. To help explain CMS's role in Indian health, we developed a video that highlights the history of Indian healthcare, CMS Tribal Consultation, and the significant impact that CMS programs have in Indian country. Since the time that video was produced, there are now 574 federally recognized tribes. The link to this YouTube video is in the downloadable PDF document and on our link slide. CMS's work is critical in the fight against the COVID-19 public health emergency. CMS has approved emergency waivers under the authority granted to the Secretary in Section 1135 of the Social Security Act. The emergency 1135 waivers provide a range of flexibilities in response to COVID-19 by waiving or modifying regulations regarding provisions of care. For example, certain Medicare and Medicaid requirements can be waived, such as conditions of participation, prior authorization, or EMTALA. There is a link to the list of 1135 waivers in the downloadable PDF document and on our link slide at the end of this presentation. CMS has approved these waivers in an average of 5 days from receipt, which is much faster than it normally takes to negotiate other types of waivers. These waivers apply to Medicare and Medicaid providers, including IHS, tribal, and urban Indian organizations that participate in Medicare and Medicaid. Under 1135 waivers, states also have flexibility on the timing of tribal consultation, including shortening consultation or conducting tribal consultation after submission of the SPA or waiver. Now let's take some time to review the protections for American Indians and Alaska Natives in Medicaid, the Children's Health Insurance Program, and the Marketplace. These are some of the special protections for American Indians enrolled in Medicaid. These special protections are often referred to as the ARA protections because they are a result of the American Recovery and Reinvestment Act of 2009. As you can see here, Indians enrolled in Medicaid or CHIP do not have to pay premiums or enrollment fees, and if they have ever received care from an Indian healthcare provider or through an ITU referral to a non-Indian provider, they do not have to pay any cost sharing, such as deductibles, co-insurance, or co-pays. However, American Indians and Alaska Natives who are eligible for care from an ITU but have never used an ITU may be subject to some cost sharing when receiving care outside the Indian health system. Therefore, it is important that eligible American Indian and Alaska Native beneficiaries use the ITU system before seeking care from non-Indian providers to avoid any cost sharing. Income determinations for Medicaid and CHIP are different from the Marketplace. In Medicaid and CHIP, certain types of Indian income and resources are not counted when determining eligibility. This slide lists some of the types of income that are not counted in Medicaid. Payments received from the tribe or individual payments from natural resources, including leases, royalties, or usage rights, farming, fishing, ranching, rents, or other monies from lands designated as Indian land by the Department of Interior are not counted when determining Medicaid eligibility. This includes land within the boundaries or the most recent former boundaries of a reservation and monies for cultural or traditional activities or items. To be clear, none of these monies are counted for Medicaid or CHIP. Keep in mind that the rules for determining income eligibility are different in Medicaid and CHIP than they are for the marketplace. For example, if you report income from traditional jewelry you sell when you file your tax returns, then you must report it when determining income eligibility for the marketplace. However, if that jewelry has cultural significance, you do not have to report that income from the sale of that jewelry for Medicaid purposes. The Division of Tribal Affairs has a great fact sheet on our website that explains all the income exclusions in detail. It is called Magi and Indian Trust Income. The link to this fact sheet is in the downloadable PDF document and on our link slide at the end of the presentation. The Medicaid application contains two important eligibility questions for American Indians and Alaska Natives. First, whether the individual is eligible for or has ever received services from IHS, tribal, and urban Indian providers to determine whether that person is eligible for the cost-sharing exemption. And second, about certain income an individual may receive from the tribe or tribal resources or activities in order to do a Medicaid determination. As I mentioned earlier, Medicaid excludes certain income from the application that may be counted on the marketplace. Answering these questions is very important to ensure that an American Indian or Alaska Native eligibility is processed appropriately and to assure the individual does not pay extra cost sharing. The link to the model application is in the downloadable PDF document and on the link slide. On the model application, the questions are in Appendix B, but keep in mind this might be located in a different place on your state's application or online. Question 3 on the model application in Appendix B is important because American Indians and Alaska Natives who are eligible for care from an Indian healthcare provider may not have ever used or received a referral from an Indian healthcare provider, are exempt from premiums and enrollment fees in American Indians and Alaska Natives who are eligible for and have received services or a referral from an Indian healthcare provider. Those folks are exempt from Medicaid cost sharing through any Medicaid provider. So, to ensure that American Indians and Alaska Natives are exempt from premiums and cost sharing under Medicaid, they should answer these questions on the Medicaid application because it allows Medicaid and CHIP programs to appropriately deduct these monies from countable income for the programs and hopefully increase the number of applicants who are eligible. Question 4 is important because providing this information helps to ensure that state Medicaid agencies do not count certain income in determining eligibility for Medicaid. American Indians and Alaska Natives who are exempt from premiums and cost sharing under Medicaid should answer these questions on the Medicaid application because it allows the Medicaid and CHIP program to appropriately deduct these monies from countable income for the program. The next couple slides highlight the Indian-specific managed care provisions from the American Recovery and Reinvestment Act that were codified in the 2016 rules. These protections protect American Indians and Alaska Natives' right to access to care and choice of provider. There are protections for Indian healthcare providers, such as the ability to contract with managed care entities and make direct referrals to non-Indian in-network providers. The managed care rules also put in place state tribal consultation provisions that require states to engage in a meaningful consultation process with federally recognized tribes and/or Indian healthcare providers located in their state prior to the submission of a SPA, waiver, or demonstration that has tribal implications. Because the managed care rule contains several Indian provisions, CMS issued an informational bulletin, which we call a SIB for short. The SIB summarizes the Indian-specific managed care provisions into one document and provides sample language for an Indian addendum that Indian healthcare providers can offer to managed care plans. The bulletin and addendum were developed with tribal input from the CMS Tribal Technical Advisory Group and reviewed on all tribes calls. The link to the SIB is in the downloadable PDF document and on the link slide. I mentioned income eligibility for Medicaid. This is one of the most important special protections for Indian eligibility, and as I mentioned, it is different on the marketplace than it is in Medicaid and CHIP. For the marketplace, The general rule is if you report something on your income tax return, you report it for marketplace purposes. We have a brochure called Understanding Cost Sharing Protections that explains all the different types of Indian income. You can find that fact sheet on our website, and we will also have the link in the downloadable PDF document and listed on the link slide as well. There are two marketplace plans for Indians. The first is zero cost sharing plan. You may qualify for this plan if your income is between 100 and 300% of the federal poverty level. For example, in 2020, 100% of the federal poverty level for a family of four is $26,200, and 300% of the federal poverty level for a family of four is $78,600. In zero cost sharing plans, you do not need a referral for services received outside the Indian health system. The second plan is called a limited cost sharing plan. You may qualify for limited cost sharing if your income is less than 100% of the federal poverty level or more than 300% of the federal poverty level. And again, that's below $26,200 or above $78,600 for a family of four in 2020. In limited cost sharing, you do need a referral for services received outside the Indian health system to avoid any cost sharing. Please visit our outreach and education page to learn more about the marketplace in American Indians and Alaska Natives. And again, that link is in the downloadable PDF document and on our link slide. Now let's move on to discussing some of our outreach and education materials. The Division of Tribal Affairs develops fact sheets and brochures. These are examples of our latest series of brochures, which have information about coverage in Indian health facilities in your state. Several years ago, we held focus groups to test material and found that utilizing graphics and pictures of tribal beneficiaries or communities increased the likelihood of the material being picked up and used. Our materials are developed to be culturally appropriate and utilized in tribal communities. All of our materials are available for download on our website or to order from our from our warehouse. We'll go over how to do that later on in the presentation. Our brochures and fact sheets cover topics like Magi and Indian trust income, which I mentioned earlier, marketplace protections for American Indians and Alaska Natives, Medicare, and Medicaid. We also update existing CMS materials to make them tribal specific to our communities, such as our tribal glossary and the tribal coverage to care brochure. We developed a dozen one-page fact sheets due to feedback that a simpler message and information with an activity on the back page would be perfect for waiting rooms. Some of those fact sheets have a coloring page or a game on the back. Please see our DTA Outreach and Education webpage for more training materials. That link is on the downloadable PDF and on our link slide. DTA also produces monthly public service announcements. We use two platforms for our monthly messages, newspaper and radio ads. We air on the radio because during the focus group testing, we found that radio is still an effective means of reaching our tribal population. We received feedback that it would be effective to also have these PSAs in some of our own languages, so we started recording them in native languages too. The link to those PSAs is on the downloadable PDF and on our link slide. For several years, these PSAs were translated into 5 tribal languages: Diné, Lakota, Ojibwe, Yupik, and Zuni. We added 5 new languages this year: Cherokee, Salish, Tohono O'odham, Tlingit, and Inupiaq. We also have an English version with local speakers from those areas as well that are aired along with the traditional language PSAs. We are aware that there are many other languages that are spoken in your communities, but we only have enough funding to translate in these 10 languages. But if you'd like to translate them for local use, please get a hold of us and we can work with you. DTA also exhibits at conferences that are not health related to increase our outreach and education to tribal beneficiaries and Indian health programs serving our tribal communities. Some examples are the National Indian Education Association, National Congress of American Indians, National Indian Council on Aging, the United National Indian Tribal Youth, and Head Start and Child Care conferences. We heard from many of you that you would like to customize a fact sheet with your own information. So we developed 4 versions of a Medicaid and CHIP flyer that you can request to be customized for your location. You can see that the 4 versions are 1, mom kissing daughter, 2, man, mom and baby, and our 4th is boy on bike. The message is the same for all of the fact sheets. Enroll in Medicaid for yourself, for your family, and for your community. These fact sheets can be used in outreach and enrollment activities to help families and individuals understand basic information about Medicaid and CHIP. They describe who may be eligible for Medicaid and CHIP, the health coverage benefits the programs provide, and how to apply. The fact sheets also cover specific protections for American Indian, Alaska Native beneficiaries and highlight the advantages of enrollment for your family and for the community. Indian healthcare providers can choose to insert their program name, website address, phone number, and up to 2 logos. You can request a customized flyer from our office, but please keep in mind that we'll take up to 5 weeks to send you a customized flyer that you're able to print. Please send your request to tribalaffairs@cms.hhs.gov with the subject Medicaid Enrollment Fact Sheet Customization Request. And you can see the email address and the subject are on the slide. The CMS Division of Tribal Affairs has a great website. You can find it easily at go.cms.gov/AIAN. Just make sure you capitalize AIAN. This is also where you find the link to our YouTube videos that includes our PSAs under the Outreach and Education Resources tab. Link to this website is on our downloadable PDF and listed on our link slide. Tribal Affairs has 2 monthly newsletters that you can sign up to receive in your email. The first is for long-term services and support. The second focuses on CMS outreach and education activities. The slide shows the website where you can sign up for the LTSS newsletter. You can see there is a link where you can click to sign up, and the link to this page is in the downloadable PDF and on our link slide. You can also sign up for our outreach and education newsletter by going to the outreach and education section of our website, scrolling down to new public service announcement box, and clicking on the sign up button. And this link is also in our downloadable PDF and on the link slide. I've mentioned several times that you can order materials from CMS. The materials are free and you can order as much as you want. This includes all of our outreach and education materials, all the fact sheets and brochures. To get started, go to our product ordering page to create an account, then log on and order materials. You can do a search for tribal specific material and see a thumbnail of the product before you order it. The link is here on this slide, in the downloadable PDF, and on our link slide. Please allow 2 weeks for your materials to arrive. You can also download materials from our website at go.cms.gov/AIAN. Another one of the services we offer is Good Health TV. Good Health TV airs health literacy and health education programming in health center and hospital waiting rooms. It currently airs CMS products in over 80 tribal facilities in 17 states. CMS holds several face-to-face trainings every year. However, due to the public health emergency, the remaining 10 face-to-face trainings will be held virtually. These will be held through a series of webinars spread out over a 1 to 2 week or 3 week period with 1 or 2 webinars a day. These trainings will still offer continuing education credits. To register or to see updated information on our new virtual trainings, please visit the website on this slide. That link is also in the downloadable PDF document and on our link slide. In addition, this year, CMS will be holding 10 medical coding boot camps. These trainings will still be held face-to-face, although they might be postponed. They are for the IHS tribal and urban coding staff. It is an intensive 2-week training that prepares staff to test at the end of the training for their AAPC certification. Participants will register with their HIM consultants in each area. These trainings are limited to 25 students per session. CMS also holds webinars on various topics like this one. Please check our spotlight page for any upcoming events. Just recently, we held a series of webinars to replace our spring face-to-face trainings that we had to cancel. We covered topics like Medicaid and Medicare, outreach and education, Social Security, and fraud and abuse. These webinars are archived on our outreach page, and the link is in the downloadable PDF and on our link slide. This is the beginning of several slides. It has all of the links that we've looked at through this presentation. I won't spend time going through these, but you have them that you can refer to later. And like I said, they're also on that downloadable page. So here are a few slides on resources. This slide has a few of the links to the fact sheets or brochures I mentioned. And then we have a few slides on websites and web pages that we've referred to. All right, and thanks for joining us today. I'm going to turn it over to Kristen Bitsui from the National Indian Health Board. We will take questions after Kristen's presentation.
Welcome, and thank you for joining us. I'm Kristen Bitsui with National Indian Health Board. I would like to thank the CMS Division of Tribal Affairs for their partnership and support in tribal outreach and education. In this presentation, I'll give you an overview of how tribal outreach and education is supported and how the historical Indian health background supports tribal outreach and education, as well as how outreach and education plays a role in Indian country. As an enrollment sister or patient benefit coordinator, you are likely the first person to talk to the patient about health insurance, the types of coverage and what it means for their care. So it's important that you have a good understanding of the history of Indian health and can explain it to the patient in basic terms and maybe use real-life examples. In the next few slides, I will share some examples on historic Indian health policy changes that have broadened the landscape of Indian health access and delivery, such as the Indian Healthcare Improvement Act. I urge you to take some time to build trust with your tribal members and patients. By learning about them and their healthcare needs, you are building trust and patients are willing to go through the application process and how they know you have their best interest in mind. When a patient is empowered with this knowledge, the patient will understand the importance of health insurance. This is an important piece to a successful outreach and education. You may have to get creative and think outside the box when reaching out to tribal community members. You may even have to come up with innovative ways to reach your audience, especially in times of crisis like we're experiencing now with the COVID pandemic, or when the federal government shut down for 45 days. What were some of the best practices that kept your facility from completely shutting down? Lessons from the past can help our future. Your knowledge of Indian Healthcare Improvement Act and the ability to explain its history can help patients to better connect the dots on many reasons to apply for these programs and the unique benefits having coverage brings to tribal members. An important piece of information that I'm sure you get many questions about is billing. Knowing how the cost of healthcare service is covered can be valuable to a patient. In 1976, Congress authorized Indian health service hospitals and clinics to bill Medicare and Medicaid and receive those reimbursements. No other federal agency can do this. So your knowledge of the health insurance marketplace and children's health insurance program is important too. Patients should know all their coverage options, especially through the marketplace and the children's health insurance program, as both of these programs have special protections and provisions for American Indian and Alaska Native. As an enrollment sister and patient benefit coordinator, your role is very vital to the role of patients' health care. You can connect them with health insurance coverage. You can help them to find a plan that suits their needs. You can help them find ways to save while getting coverage for the entire family. So your main role is educating the patient. Your approach to outreach and education can be displayed in several ways. Get creative. Remember that out-of-box thinking. Especially another thing is responsibility is giving them information so they can understand that there are special protections and provisions for American Indian and Alaska Native, as well as providing education and conducting outreach to tribal members on the importance of health insurance. So last year, NIHB had the opportunity to visit several ITU facilities to see all the various different tactics on how tribal members receive outreach and education on health insurance. Many of the educational materials that were being used within the tribal facilities were specific to needs of the tribal community. The need to focus on uninsured groups was shared throughout the site visit, and many shared some of the barriers and challenges that the sites encountered. But there was one consistent focus. All of the tribal enrollment sisters and patient benefit coordinators are hard workers and have a passion to enroll tribal members in health insurance. Your outreach and education efforts should continue within the tribal communities during the COVID-19 pandemic. Because of the COVID, health care delivery has changed a bit, like patients are not able to go into the facilities and no more face-to-face meetings. I want you to think about the challenges COVID has brought. Then think about the different ways you did your outreach and education during difficult times, like during the federal government shutdown, and adapt these enrollment best practices to the current crisis situation. I know personally, pharmacy revenue was a big topic that was shared with me during the training last year. Many sites, even urban Indian health facilities, were searching for ways to increase revenue through its pharmacy. With Medicaid and Medicare managed care, there are places within Indian country where managed care works for individuals, and there are other places where that is not the case. Tribal sponsorship has also played a role in increasing third-party revenue. So let's talk a little bit about in-reach education within your facility and how it can help to assist all staff members from providers to public health nurses and even administrative staff. By sharing knowledge about health coverage and enrollment with other staff members, you are ensuring more patient touch points, more opportunities for patients to learn about their coverage options. A tribal facility I had visited gave a great example of this, where the tribal enrollment sister worked with staff within the facility as a team to see who referred the most patients over to the patient benefits program. This facility went even deeper and put in an estimate on how much money was saved using the amount of patients that had referred through the patient-referred care. These are some things you can think about when you're doing your in-reach. Finally, enrollment sisters should be providing resources and knowing which resources are specific to the patient needs. If they are over income for Medicaid, what are their other options? Maybe the best option is to find a plan through the health insurance marketplace. It is your responsibility to share the best options for the patient's needs. Perhaps you have a patient with kidney problems. Coverage through the American Kidney Fund Health Insurance Premium Program might be the best plan. So continue to learn about coverage options so you can better assist with patients. We realize that there are challenges within Indian healthcare programs that may make your outreach and education efforts challenging, particularly when trying to enroll patients and they are not interested or in the dark about health insurance. One of the biggest challenges is when a patient says that they don't need health insurance because the federal government is supposed to provide health care to all American Indians and Alaska Natives. And while this is true, what is also true is that having health insurance covers all the care that IHS simply cannot. But through understanding of the history of health insurance, the Indian Healthcare Improvement Act, and all the health coverage programs, you have the ability to share specific coverage benefits, health gains, and cost information to the patient. Remember, IHS and tribal facilities are the only facilities that can bill Medicare, Medicaid, and CHIP. You may also encounter tribal members who are frustrated when they call the healthcare.gov, and the person assisting them is unfamiliar with American Indian and Alaska Native and the Indian health system. This poses a challenge, but it's a challenge that you can help overcome with your expertise. Patients with a tribal member and resources available from NIHB, CMS, and IHS This is why enrollment assisters and patient benefit coordinators are so vital. You also may find that many tribal members do not want to share their income information. This is where building trust comes into play. It's your job as a tribal enrollment assister or patient benefit coordinator to tell the patients the reason why providing their income information is actually for their benefit. They need to feel assured and comfort that their information will only be used to check their eligibility for Medicaid and plan options in Marketplace. Take the time to build that trust. It is an important tool for your line of work. Again, continue to educate yourself. Know who the tribal liaison or tribal representative is in your state Medicaid, or the Native American contact in your region. Build a relationship with them. As you may know, each state is different when it comes to managed care. So it's important to know the right people to turn to for answers and resources. Because of COVID, there's been a stop to all face-to-face meetings and trainings, but there is no shortage of Zoom meetings and conference calls. I encourage you to keep informed about the current healthcare climate as it relates to COVID and stay updated on state rules, IHS announcements, and any CMS resources. NIHB continues to be your ally in this work, so call or email me if you have any questions. That said, CMS materials are still available, so if you can, if you can, place your order. The materials are all tribal specific and free. We encourage you to use the content and share it on your social media platforms. CMS also has videos that you can download from the website and show in your waiting rooms. In some facilities, the videos are already broadcast on Good Health TV, as Rachel had mentioned. Again, CMS is a resource, and our materials are also downloaded, or you can also download from our website too. As mentioned before, it's important to know who to contact to get your questions answered. It may be that state tribal liaison or your Native American contact. Either way, build that relationship and become partners in your outreach and education effort. Outreach materials are your best resources to educate tribal members about the importance and benefits of having health coverage. CMS has printed materials available such as flyers and brochures, as well as scripts for radio and videos to show in clinics. These materials were made to assist your vital work. Also, consider using social media as an outreach platform. Just about everyone has a smartphone and is tied to some type of news feed daily. If your facility has a Facebook page, start posting enrollment information there, and when you're meeting with a patient, encourage them to follow the page for updates and information. The reach of social media is very powerful. Educating patients on their health care and coverage options should be a facility-wide and program-wide effort. To be successful, it is a team effort. Help from departments and areas outside of patient benefit coordination programs. Public health nurses are so incredibly important to community outreach, especially now with COVID and tribal stay-at-home orders. Community health representatives also are key to making those connections with tribal members, and they can help with delivering messages about the Medicaid application renewal. And if they don't have health insurance, they can share with the patient contact information of the tribal enrollment assister or the patient benefit coordinator. Work with your colleagues. Healthcare is a group effort. I'll continue to express how important your role is in patient care. Think about it as a good customer service. When a patient has a good experience with you and feels comfortable that you have all the right information, then they are likely to tell their family members, friends, and other tribal community members. That's the snowball method. You want that snowball method. Questions from patients are not going to stop. As long as they are engaged and interested, they will ask more information. So it's good to identify some of the barriers and challenges to be better prepared to answer those tough questions or walk through applications or notices received in the mail. Tribal members often have questions like, why did I get this in the mail about Medicaid? Or I don't understand my application. Knowing these are common questions, you are able to answer them quickly and accurately, hopefully with some resources to provide further assurance to the patient. Your work empowers tribal members to make a conscious choice about their health care. They are the ones making the decisions. They are the ones in charge. Your role is to provide them with all the information, knowledge, resource, updates to help them guide them in making a choice about health insurance coverage. Give them information about changes in their Indian health facilities. Tell them how COVID is impacting the community. Assure them that they are a resource and have their best interests in mind. Remember, trust is important among tribal members. Take the time to build it. Here are some contact information for those who can help you with questions or issues you encounter. You have your CMS State of American contact. You can also reach out to the State Medicaid Tribal Liaison. Other places you can look for resources is at the CMS webpage, and Rachel had gone over some on her slides also. And then you can go to the Technical Assistant page. It provides information on eligibility, enrollment, and more. You can also email Indian Health Service and share information, or if you have any questions, please know that all these resources are at your fingertips. As you all know, I'm always here to help you as well. Thank you to each and every one of you who is on the call for all the work that you do in educating the tribal members about the importance of health insurance. I'll go ahead and turn it back over to Amanda-Marie.
Thank you, Kristen. We will now move into the Q&A portion of the webinar. Please enter your questions into the Q&A pod located at the bottom right side of your screen. Our first question is directed at Rachel. Who can we contact about errors with coordination of benefits? Some people are being forced to pay for all prescriptions because their Part D plans won't pay out.
Hi, thanks for the question. I think we might need a little bit more information. If you could send that to our Tribal Affairs mailbox, and that email address is on the last slide of my presentation. I'll also put it in the, I don't know if we have a group chat, but it's all one word, Tribal Affairs at cms.hhs.gov. If you could send us that with maybe a little bit more information and even a contact number, maybe we can circle back with you and we can find somebody at Part D that we could speak with, and we might be able to resolve that in Tribal Affairs.
Thank you. Our next question is directed towards Kristen. Is healthcare.gov supposed to save tribal ID information after submission? Some tribal members have been asked to provide their information or upload their tribal ID multiple times this year.
So if it is a continuous application, their tribal ID should be saved. If it's a brand new application, then they would have to submit those documents again.
Thank you. We will now take a few questions from the phone through our operator. Operator, can you please give instructions for asking a question over the phone?
As a reminder, to ask a question over the phone, please press star followed by the number 1 on your telephone keypad. Once again, that's star 1 on your telephone keypad. We'll pause for a moment to compile the Q&A roster. No question on the line at this time. You may continue.
Okay, we have no remaining questions. This concludes our Q&A session. Finally, as a reminder, there is one upcoming webinar under the IT webinar series. Please join us for this webinar on the Office of the Inspector General, Preventing Fraud, Waste, and Abuse on June 25th at 2 p.m. Eastern. Thank you for joining today's webinar. Our session is now concluded. Have a great rest of your day.